Welcome to the Canadian Dental Hygienists Association, the national voice of more than 30,000 dental hygienists in Canada, directly representing 21,000 members, including students. Bienvenue à l'ACHD, votre voix, votre profession. Since 1963, CDHA has been inspired by the strength, passion, and dedication of our members to move the profession forward through advocacy initiatives, public awareness campaigns, research, education, and interprofessional collaboration. We are so proud to highlight the achievements from our 2020-2021 fiscal year in this annual report. CDHA engages in advocacy to advance the dental hygiene profession and promote the importance of oral health to policymakers. Our goal is ultimately to improve the health and well-being of all Canadians. Even in a pandemic year, when so much of our advocacy work focused on meeting the urgent financial, health, and safety needs of dental hygienists, our staff and board directors were able to keep key oral health care issues on the national agenda. CDHA staff met throughout the year with federal policymakers and elected officials to review priority issues, including access to care, national standards for oral health care in long-term care homes, universal oral care for vulnerable populations, and the impact of the COVID-19 pandemic on the profession. We also prepared a pre-budget submission to the House of Commons Standing Committee on Finance, highlighting the need for universal dental care, national standards for long-term care and home care, and student loan forgiveness. Thanks to our strong relationship with the Office of the Chief Dental Officer, led by Dr. James Taylor, and the Public Health Agency of Canada, we were able to share the latest information on COVID-19 vaccine development and distribution, supports for the healthcare workforce, and resources to address vaccine hesitancy with dental hygienists across Canada. CDHA's national voice also drew attention to mental health and smoking cessation issues, thanks to our ongoing collaborations with other healthcare organizations and coalitions, such as the Organizations for Health Action, the Extended Health Professions Coalition, the Mental Health and Chronic Disease Network, and of course, our constituent provincial dental hygiene associations.
CDHA supports dental hygienists as integral members of the healthcare team in all workplace settings and at all career stages. We provide professional liability insurance, a confidential counseling service, guidance for independent practitioners, and a vast array of employment and workplace resources. This past year, we developed resources to address workplace issues such as bullying and harassment, infection control, contract negotiations, mental and physical health, and workplace safety. Our partnership with the Canadian Dental Assistants Association and the Canadian Dental Association on Healthy Workplace Matters, a web microsite, demonstrated the power of positive working relationships and the important role that every member of the oral care team plays in creating and sustaining healthy and respectful workplace. CDHA offered 3 virtual learning and networking opportunities for independent dental hygiene practitioners and provided regular updates on insurance coverage and federal support programs. We also updated our national list of service codes to capture new codes for telephone and video appointments, so vital during COVID-19 lockdowns, and now a great alternative platform for care. After many years of advocacy, CDHA was delighted to announce that Manulife would begin accepting electronic claim submissions from independent practitioners, expanding the EDI options for our members. CDHA's job board, one of the most active areas of our website, saw a 46% increase in job postings last year. It's definitely a great place for dental hygienists to connect with prospective employers. This past year, our dynamic educator community met pandemic teaching challenges head-on. To support their efforts, we hosted a 2-day virtual program directors symposium, bringing together directors from all Canadian dental hygiene programs to talk about regulatory issues, interprofessional education, pandemic-driven curriculum modifications, and new dental hygiene competencies for entry to practice.
Promoting the value of professional dental hygiene care to the public is a cornerstone of CDHA's activities. Through print, television, web, and billboard advertising, media interviews and supplements, national public awareness campaigns, our website, and social media presence, we educate Canadians on the work of dental hygienists and the important links between oral and overall health. Our national advertising strategy featured powerful visual messages and images reminding Canadians of the essential oral care services that dental hygienists provide. Our ads ran on television, in newspapers, on Google and YouTube, key news websites, and for the first time ever, on 77 billboards across Canada. CDHA's Image Bank continued to offer free, high-quality photos that accurately portray dental hygienists in action. National Dental Hygienists Week, our popular public awareness campaign held every year, April 4th to 10th, was hugely successful despite the ongoing pandemic restrictions. We saw a record-breaking 41 landmarks lit purple across the country. There were more than 12,000 downloads of our NDHW resources, 570 entries to our annual coloring contest, and close to 50,000 views of our NDHW web pages. Our Put Your Purple On campaign received 1,110 photo entries from members who enthusiastically showed us their DH Purple pride. Canada's 4th Dental Hygiene Superhero Competition, sponsored by Sensodyne, celebrated dental hygienists who are ambassadors of the profession and model exceptional client care. This past year, we received 778 nominations. Canada's newest dental hygiene superhero is Natasha Kellett, with honorable mentions going to Holly Reinard and Mara Sand. Social media is and was a great vehicle for CDHA, allowing us to share key messages quickly to an ever-growing network, now surpassing 18,000 strong across all platforms. Last year, our YouTube channel marked an amazing milestone, surpassing 1 million views.
CDHA is known as a source of credible, high-quality professional development offerings for dental hygienists. From our flagship publications, the Canadian Journal of Dental Hygiene and O Canada, to our position papers and statements, webinars, and online courses, we offered a variety of opportunities for members to contribute to and learn from the latest in oral health research and education. The Canadian Journal of Dental Hygiene was formally accepted into Medline in October 2020, placing it in the top tier of peer-reviewed biomedical publications globally. The journal also launched a dedicated website to increase the visibility and accessibility of its articles to researchers around the globe. CDHA published 3 position papers in its internationally recognized Oral Systemic Link series, exploring the relationship between periodontal disease and adverse pregnancy outcomes, respiratory diseases, and type 2 diabetes. O Canada, our magazine, now has a 91% satisfaction rating among members. It continues to highlight the work of Canadian dental hygienists and shares clinically relevant information to support evidence-based practice. We offered 11 webinars on a variety of timely and important topics. All had an above 80% satisfaction rate. For a snapshot of ongoing association activities and trends in oral care products, members needed to look no further than our bi-weekly e-newsletter, our semi-annual Oral Health Products e-bulletin, and our annual Advocacy in Action e-newsletter.
Your CDHA Board of Directors recognizes the importance of developing the profession's leaders for today and tomorrow. We celebrated exceptional volunteer service, research, and writing through our many award programs. CDHA's Student Leadership Program now boasts 57 participants from 29 accredited dental hygiene programs from all across the country. These junior and senior representatives gain valuable presentation and networking skills while in the program. And in 2020, each received a Student Leadership Bursary courtesy of Colgate. CDHA's work was greatly assisted by our dedicated industry partners who understand the integral role that dental hygienists play on the oral health care team and are committed to helping us advance the dental hygiene profession. At CDHA, We know that the success of our association depends on the vitality and expertise of our members. I am proud to say that as of April 30th, 2021, we had 21,183 members.
For over a year now, the COVID-19 pandemic has had a profound impact on all our lives, professionally and personally. In the early months of the pandemic, CDHA worked tirelessly to ensure that dental hygienists and dental hygiene students would be eligible for federal financial assistance programs and have priority access to high-quality personal protective equipment and COVID-19 vaccines. Social media posts and letter-writing campaigns by our members to local, provincial, territorial, and federal officials played a key role in our success. Two long-standing dental industry partners, Procter & Gamble and Colgate, funded much-needed programs to support our members facing financial and business hardship during the pandemic. To help our members maintain and improve their knowledge of the coronavirus-related issues and evidence-based practice, we enhanced access to free, high-quality webinars, online courses, videos, and podcasts, totaling more than 60 hours of learning. We also produced a comprehensive return-to-work handbook and released a video and FAQ on pandemic-related employment issues. We kept our finger on the pulse of members' pandemic concerns, thanks to regular surveys, more than 50 e-bulletins, and a safety alerts hotline. We also assessed the impact of the pandemic on consumers' dental hygiene care through a national public opinion poll, which revealed that, although many people opted to defer oral care until after the pandemic, almost all who received professional dental hygiene care were satisfied and felt safe. Our COVID-19 timeline tells the story of our collective effort to meet the challenges of the pandemic with grace, certainty, and strength.
CDHA's successes as presented in our COVID-19 timeline and this annual report are your successes. Ensemble, nous sommes tous plus forts avec la CHD. Together, we are CDHA strong.